Welcome to another episode of Audio Audacity Podcast. I'm your host, Mo Brooks. Across from me, we have who? Who are you?
Chocolate.
Who?
Chocolate.
All right. Next to me, we got who?
Texas homegrown, bam, bam, bam.
Next to you, we have who?
April, Boss Lady Brooks, wife of Mo.
And next to you, we have a special guest, and your name is?
Nicky.
All right, Nicky. So, here we go. Today's episode is sponsored by Gia Turner Realtor. Now is the time to buy because interest rates are low, historically low. Gia has a team, a credit manager to help you clean your credit legally, which is very important, and a finance manager to help you get what you need for your new home based on that credit. Let them get you in your dream home right now. Not now, but right now. Today, ASAP. And it's also a seller's market. So the time is now to sell your property and get top dollar for your home or your land and bring in a nice little profit. So call Gia today. Gia, G-I-A, Turner, T-U-N-E-R, Realtor and Associate by Berkshire Hathaway. She can be reached at 314-323-1589 or reach her at www.homesbygiaturner.com. And now on to the show. Today's episode of the Audio Audacity Podcast is episode number 12. We're speaking about the Pan-19 pandemic and healthcare. So today we have Nicky in the building, and she is a if you can give us a little bit about your background as much as you can, without having any issues or situations.
Oh, of course. Well, I'm a registered nurse. I've been a nurse now for almost 9 years. I've been in the medical field over 20 years. Right now, I'm in a float pool, so I work all over the hospital, like wherever it's needed. The only place I don't work is a surgery.
Okay.
But I go everywhere else.
Okay, and you said you've been doing it for over almost 20 years or more, or okay. And is there a specialty of yours that you handle more so than anything currently?
Well, right now, I'm working in the emergency room mainly. So mainly in the ER, which is where the most need is. Okay. At this point. So.
Okay. All right.
Yeah.
So, if I may ask you, what is the current state of the healthcare system?
It's crumbling.
Wow.
And I don't say that lightly either. I've never seen anything like this. In my whole time of being in healthcare, I've never seen anything like this. It's a shortage of staff, and not just nurses. I mean, it's a shortage of nurses, it's a shortage of techs, but on top of that, we have so many patients that it's like it's not enough beds for the patients, nor not enough staff to take care of them. So what we're seeing are people just dying. It's no different than the first wave of COVID, except for, in my opinion, and I worked in the ICU during the first wave because I helped out in the ICU, and I helped out like in our, it's what we called our high flow area where everyone had to be on some sort of like breathing machine. So I was there through all of it, taking all the bodies down to the morgue, seeing everybody die, husbands and wives next to each other, brothers and sisters. I saw all of that. And there was a lot of death then, but now we're seeing still people dying from COVID.
Just say pandemic.
I'm so sorry.
Yeah.
From the pandemic.
Right.
Still people dying from that, but there are also just people dying from other issues because we don't have enough beds for these people. So people are literally sitting in our emergency rooms for like 30 hours. 30 hours. Damn. You got people out there bleeding. I can give an instance where, and like I said, I've been really emotional this week because seeing this kind of stuff like on a daily, you putting in all this overtime because you're trying to help out is very taxing, like to your mental status. But we had a lady we brought back. She sat in the emergency room for 31 hours, brought her back just very bad gastrointestinal bleed. She ended up passing away. We're having people pass away in the emergency room because they're sitting out in that ER waiting room for so long, but you can only put so many people in the back. We got such a shortage that you can only have so many patients back there because you only got so many nurses.
Right.
You know, it's like not really much that you can do. And it's disheartening because none of us got into the medical field to have to be taking care of patients and it be this particular situation. It's really, really sad.
Damn.
It's bad.
That is definitely an audacity right there, for real.
It is. And one of the big problems, which is they keep talking about it on the news, every hospital has put out something about it. Do not come to the emergency room unless it's a true emergency. Yeah. Don't come in the emergency room because your tooth hurt. Don't come there for, I got back pain. Back pain can be a sign of something serious, but most time it's a muscle strain. Right. That is putting a strain on the emergency rooms because people are coming there for something that's not an emergency. Right. So then it's just taking up space, and then they're always the main ones ready to fight us. They want to fight. They cursing us out. So we're taking mental abuse. People getting beat up. I got coworkers that had got their teeth knocked out, black eyes. It's ridiculous right now.
It sounds like the front line of a war.
It is. It really is. It's ridiculous.
Damn.
So that's like what we're dealing with right now.
And what, if anything, what could help alleviate this just a little bit, besides not coming in for bogus or non-life-threatening ER issues?
I think the only other thing that could probably help is getting more staff. We would need more staff, and unfortunately, we're no longer in Missouri in a state of emergency, so, we couldn't even depend on. There are other states right now that have the National Guard coming in to help people.
Wow.
And they're just having them come in and help out.
So is there any type of hotline or something somewhere they can call, tell them over the phone what their symptoms are, and have that alleviated, like over the phone? Take this, do that, lay down.
Because there's an option where you can do virtual, a lot of virtual care is going on right. Yeah, so you can do like telehealth. That's become real big, where your doctor may not be able to get you in, but you can do like a video chat, and you can tell them your symptoms, because we got people that just want to come in and be tested. The emergency room ain't the place for that. Because this is my thing. If you feel fine, you may feel sick, but if you don't feel like you're dying, okay, so we're going to tell you have it, and then what? You wasting precious time. Yeah. Can I curse on here?
Yes.
Sit your ass at home. Okay, quarantine. And just get better. Don't run to the emergency room because you're like, I want to know if I got it.
Especially when they have centers. They have all the centers. You got home testing. You got Walgreens. You got all that.
Yes, you got.
Yeah, everything.
Even you got. I know what you call it, not the ER, but the spot,
like an urgent care.
Yeah, urgent care.
Yeah. Okay. And don't get me wrong, I know a lot of them are taxed as well because they're not having the staff. Also, everybody was already short. And then it's a lot of people. So many of my coworkers have it right now, and they're out.
And that was going to be my next question. Have you lost coworkers to this particular pandemic?
We just recently had one pass away actually last week, and then she was like an older coworker of mine, but she worked at another hospital. And then I've seen some younger ones younger than me.
Oh wow!
They got it, and now they cannot work as nurses anymore. Like their heart and their lungs are like they are like one of long haulers.
Oh my God!
And they're messed up. They cannot work as nurses anymore. So it did take a lot of people out of circulation as being able to work as a nurse. So we got that issue as well. So
which takes us back to a shortage of people to even be able to help. Oh my God, that's a vicious.
There are people that have come out of retirement and have gone to being travel nurses because the money is ridiculous right now. That's probably about the only positive thing that came out of this.
Is the money.
That we're finally being compensated the way we should have always been compensated. We here saving people's lives. Yeah. You got people flipping burgers and working in some of these other places that's making what they were offering some of these nurses base pay, which is ridiculous.
I feel like that teachers, nurses, especially, people that's dealing with people
Emergency
should be paid
responders.
like basketball
Yes,
players
yes.
and football players.
That was my big
Yes.
deal.
Especially, like I said, teachers, nurses. Your doctors get paid that way. They get paid like basketball players. Why don't nurses? And nurses, to me, do more of the work than the doctors
We're the
do.
ones there
Yeah.
24/7.
Yeah.
We have to
Sometimes the
catch
doc
everything.
just
When I went to nursing
sign up.
school, I had to pretty much learn the majority of what a doctor knows because we got to be able to catch this stuff. They're in there all of 5 minutes. We're in there 24/7. We're looking at the labs. We're calling them. There's certain doctors we call and just tell them what we need. Okay, can I put this order in? I'm about to put in this, and a third. Where they put in orders and it's the wrong thing. We call back. You sure you want to get them this? They're a dialysis patient. You gonna fluid overload them? We catch all their mistakes. We tell them what to do.
Right.
We catch everything going on with the patient.
Right.
But we weren't being paid. And that's another reason a lot of them ran away from the bedside. They was like, I'm not doing this. So now you got this high need. You got these travel nurses out here making ridiculous money. I mean, they're making like between $10,000 to $12,000 a week.
Oh, nice.
There are nurse practitioners that have left from being an NP, which is above an RN, and they've gone back to being a registered nurse because we're making more money than them right now. We're making more money than some of these doctors right now. I know nurses that made almost $400 grand last year.
Dang.
So
Damn.
At this point, I mean, they put Betty at the end of nurse, but I think I could do it.
You what now?
What's in your
I
mouth?
love it.
Come on, what's it? What now? Try that again.
She said a whole sentence.
So the microphone.
My cousin is a travel nurse, and she uprooted all herself, a husband, and all 8 of her children. She got 9, but 8
At home.
at home. So she uprooted, and they travel. And not
That's
only
just what
does
it
she travel nurse, she also works a job where she's it's like a telehealth type of situation where she's just calling her client. She gets online, she monitors her clients, and she does this in between breaks. She does this when she should be sleeping. She does this in the middle of the night. And if they don't check in, if they don't do their blood pressures, if they're not going to the doctor's appointments, she calls them and say, "Hey, what's up? What you doing?" And then they tell her what they tell her. She type it up, put in the system, keep going, and she makes over $100,000 a year doing just that. Plus the $300,000 a year that she made off of travel nursing last year. So
Telehealth is big right now because I ran across a few where I don't even have to leave my house and I could make $4,000 a week just sitting at home.
yeah, monitor clients.
But I have more of a passion to be actually
Frontline.
in,
Hands-on.
actually in the field. I have to
feel you.
deal with people.
So how does that affect your personal life, your love life, your sleeping habits, your eating habits? How does that affect all of that?
Well, I work night shift, so let's start there.
How much time you got, buddy?
Night shift is like, it's ridiculous. It's already taxing on your body. So just like I just had 4 days off, I peeled myself out of bed to come here, and I've been literally laying around the past 3 days. Like, I'm exhausted from just working those kind of hours. Like, I think I just done like 66 hours in a row. I'm tired. You doing 66 hours in a row and it's night shift? You know what I mean? You're exhausted, but don't get me wrong. I'm being highly compensated for that.
Right.
But, it's exhausting. I'm like, hell, who has time to spend the money? Because all I want to do is sleep. Sometimes I don't even eat because I'll have my alarm set and I wake up and I'm so sleepy. I set that joker. I'll be like, sleep to the last minute. And I'll go to work and I haven't eaten a meal. I've looked up and been like, damn, it's been 2 days since I ate a meal. Because I'm just stuck in, like, work mode.
Right.
And that's it. And then as far as even with, my love life, having time with my fiance, I'm so sleepy all the time that every time he's like wanting to do something or coming in and talk to me, I'm asleep. I come in, I done fell asleep again because all I do is sleep off and on throughout the day. So it's like, it's not a lot of time to really do anything.
Right.
It takes over.
Okay. Before I move to the next question, anybody have questions currently right now?
What do you? Okay, you say fiance, so you engaged. Congratulations. So if you had to at this moment, do you see yourself really keep doing this for a long term, considering that it still could, your situation with your relationship? Because it don't seem like this is going nowhere no time soon.
This is true. I think I have enough of a passion for it, and this is my problem too. I start really caring about my coworkers, and then I'm like, oh man, I don't want to come in. Then they send us little messages. You know, we have like a little staffing thing, so they'll put messages in our group on Facebook. They're like, we're short, and I'm like, oh man, I really should go in and help them. Because it's like, I want to help them, but then I be thinking about the patients too, because I'm like, the less of us that's there,
Yeah.
the less, and honestly,
Less
I'm
likely.
like, I don't have no energy at home, but I'm like ADHD at work. I'm
Yeah.
like two workers.
Yeah.
And I'm like high energy the whole time. Like
Yeah.
from the time I get there till I go home. And they like that about me. So it's like, I know if I go, it is going to actually make a difference. So I probably will do it for a while. Now, this retirement wise, I'm going to do a diabetes education job, which I've done there also. I did that for 2 years. Was studying to get my CDE, which is like certified diabetes educator. That's what I want to do retirement wise, because it's easy. I'm diabetic. It's something I know about. I've been a diabetic for 36 years, and I know how to manage that. You know,
But you
so
skip meals. You're skipping meals.
I am skipping meals.
That's not
but
healthy for
I
you.
can afford to do it though, because I'm on an insulin pump.
Okay.
So I can
Yeah.
regulate my stuff a
Right.
little bit better. People that are on injections, they can't necessarily do that. I can't.
Until it's too
You
late.
say a pump?
No,
Yeah.
no, she'll
It
have
stay
plenty
on
of
you?
warning.
I ain't talking about her. I'm
Oh,
talking
it's
It
my
stays,
yeah.
Yeah.
it stays in, so it's like constantly giving me insulin. So I can play around a little
Right,
bit. Versus
right.
when I was injections, I couldn't do that.
Okay.
Yeah. So
Next question is: does the type of insurance you have determine your level of care at the hospital? That's a good question right there.
It's everywhere, not just at the hospital.
So this is what I'm gonna say from what I've seen, and I've worked for 2 different big healthcare systems.
Okay.
We don't care what kind of insurance you got. Let me be very blunt.
All right.
And I've had to say this to many patients, because the main thing we always want to hear, wooty wooty woo, pow 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 pow. I got good insurance. I work as a man. We don't give a shit. Cause guess what? As a nurse, the way I'm treating you, my pay is the same.
Yeah.
I don't care if you got zero insurance or you got Anthem, you got United Healthcare. None of that matters. The room you get your insurance has no bearing on that. These people that are picking your room are all the way in another building.
Wow.
They not going through, let me see what kind of insurance they got so I can see what kind of room to give them. That has no bearing on your treatment, because we're all going to get paid the same. When you work at a non-for-profit hospital, we get our money regardless. We're going to get it, because we're going to get it from the government or we're going to get it from your insurance company. So we don't care.
So,
It has no bearing.
so
on
basically,
how
I need a single room.
so basically,
I need a single.
I
So,
promise you.
That's from a nursing standpoint, though.
right.
So it's
Yeah.
it's different.
Yeah,
Things
because
are
I need a
different.
single room.
Well, then speak on it.
They're all single now. Nobody's going to have double rooms.
No, I
Oh,
don't
for
think
real?
I've seen a double
So on
room
your
in hell.
behalf,
Oh, okay.
speak on what you know about.
There are some hospitals that still do double rooms, but because of pandemic, they try
Yeah.
not to put, unless they absolutely know that these 2 people are not, and they don't allow visitors, then they're more comfortable with it. But there are some. But I can speak on that coming from being a patient.
Right.
I had kidney disease. I went through all the stages, and even after I got to 5, it still took 1.5 years for my kidneys to fully fail. So with that being said, when I was at stage 4, I was eligible to go on the transplant list. Guess why I couldn't get on there?
Your insurance?
Insurance. So, insurance. If I would have had, and it's not just saying just insurance, period. You have to have the right insurance that's going to pay from A to Z for the hospital stay, the medications, just everything. And if you don't, they cannot let you, everything else can fall in line. They cannot let you on that transplant list, whether it's kidney, heart, lung, what have you, liver, pancreas.
liver.
Yeah, what have you. You know, those are considerations. It affects your health care, not on a nursing standpoint, because like she said, as a nurse, she don't go look in your chart to see what type of insurance you got. The techs don't do it. The LPNs, no one does that. But when you first register, they have to know, okay, we can only let you stay in the hospital one day because your insurance isn't allowing. Insurance will dictate. It's not, they don't choose.
It would
They don't
technically
choose.
be
Insurance dictates.
situational. Like the particular
Situational.
hospitals.
Exactly.
Christian versus St. Joseph. When I went to Christian, I'm in the hall in the bed. And they talking, and the girl was like, okay, we're going to go ahead and admit her. Why? She got a headache. I mean, I'm hearing them talking about, here we go again. And then I heard, well, does she even got insurance? I heard this. And she was like, she might just be a drug seeker. I heard this. And it's like, well, Miss Brooks, if you don't have insurance, then I'm going to need for you to fill out this. I said, I have insurance. My husband is coming. He got the card.
Totally.
And it's like, why are y'all discussing that?
Yeah. Inappropriate, not the right people you should have been discussing that with. And
they had no
the
right
list
to ask
goes
me that.
on and on, and you could have filed a grievance, but I understand.
And that's a lot of things people don't understand
Yeah.
at hospitals. You don't even realize it's the fine print. You have so many different rights as far as a hospital. I learned that when I had my first baby. He turn me away. I'm in labor. You gotta do this. He finna drop. You can't say nope. You know what? We're gonna send you in an ambulance. Da 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 da. And they did. They sent me an ambulance from St. Mary's, Illinois, with St. Mary's Hospital over to St. Louis.
But they can dictate how they treat you.
And I'm like, bro, this is crazy.
It dictates what type of treatment you
That's
get.
what I think it's
But once you
situational.
get to the nurse and everyone else, they don't give a damn.
And then
what
Christian
you got,
deal
whether
with
you got.
they deal with
And-
pregnancies and gunshot wound victims and drug seekers.
You have to
often.
You have to pay attention to the area. I can go.
few.
I can
regular.
go to MB and
Yeah, okay, I had to think about it.
be ball and go right in, ER. They give me a room because my prior diagnosis, and it is what it is. I can go to my main one, which is the city, and so I can go there, baby. I don't care if my lungs could be falling out on the ground, and I'm gonna wait there for 8, 15, 20, 30, 40 hours.
We've done
And
that.
it doesn't even matter.
We've done that.
But because of what's going on with me, I can make a phone call.
Yeah.
Transplant unit, hey, this, that, and the other going on. Okay, we'll give you a call back in a few minutes. They call me back. We got your bed. We need you to be here at 7 o'clock or 8 o'clock in the morning.
Like DoorDash.
But that has insurance plays a part in that too.
Yeah, that's why I said
So,
I think it is
but
situational.
but like I
Then they're
said,
gonna get their money.
Definitely.
dealing with the nursing standpoint, no, absolutely no,
Right.
no difference.
Because I get what you're saying, because this is true. You do have to have, which is why when people go to their jobs or you pick private insurance, you want to pick something that's going to cover things, because certain stuff they're not going to cover. Now, I will say this: I've seen them at my hospital many a time operate on people over and over, don't got a lick of insurance, and we doing surgeries on them, trying to save their feet, trying to, you know what I'm saying, cutting off toes, trying to save. They don't say, oh, we're not going to do it because you ain't got no insurance. They still do it.
Because
You know, they
money
still
regardless.
do it. And that's the thing. It's a difference between a hospital that's non-for-profit and one that is, because we're going to get our money regardless. We don't be like, oh, I done seen them admit so many people. And I'll be honest, sometimes they do crazy admissions. And I'm like, why we admit them for this? Okay, they got a gun app. I be like, okay. And I don't mean to be like that, but
You
then
don't have a
right,
dentist
what's
on
going
duty.
on right now? I'm sorry. Why are you?
But they
admitting
be
in
the
hospital for
neediest
that?
people, and they're taking away the care that you could be giving to people that actually need
I'd
you.
like so refer them to a dentist, give them some antibiotics, clear that infection up, and then you need to go to a dentist, because we don't have no dentist that's gonna come in and pull your tooth. Yes, that can be bad because that can travel to your heart. An infection can be, your mouth health. People don't realize how serious this is. That can travel to your heart and cause serious problems. But Don't be in here ready to fight me because you done sat in the waiting room for 20 hours and you ain't see, because I done been in many of codes just in this past week. You don't see what the ambulance is bringing in the back. They don't come through the front door with these people. We got people coming in dying left and right. If you ain't got nothing but a handful of staff, you need all hands on deck. Then you got this code going on. Then this code. This guy's having an active MI. Yeah, you gonna sit your ass in this waiting room because you're not dying.
Exactly.
And nobody means to be rude, but you're not dying. And we've had people literally, we've had to pull them out of they're in the middle of having a seizure in the waiting room. They get up ready to fight. Cause sit your ass down. I'll be so quick.
Right.
They know. I'm all like RN/security. I don't play up in that place. You gonna do what? You gonna sit your ass back down in that seat. Or you can leave. What you want to do?
Flat out.
You know what I mean? We're here to save lives. This is an emergency
If you have
room.
enough energy to act the fool, you don't need to be here.
Because I'm going to tell you what's been going on and what people probably don't realize. Even our EMS services are struggling. Do you know we had somebody come to the ED, was that last week or the week before? I get my days and stuff because I'm there so much. He had to drive himself in. He was having an active, massive heart attack. He called EMS. They told him it was going to be 10 hours before they could get an ambulance to him. 10 hours. That man damn near didn't make it. It was by the grace of God. He drove in there having an active heart attack. He's not the first one we've had where they're calling. They even just had a story on the news. They're calling, and there's not even enough EMS drivers to come get these people. But then we got people rolling in. This is what be pissing me off. We got people rolling in. I had UTI symptoms, and you on a stretcher. Where do you want to put their ass out in the waiting room? You really call 911 for that? They need to reform and
because
tell us.
they figured that 911 by them coming in EMS,
It's gonna get them right in.
and that's not
Nah,
fair
Put
anymore.
them right back
So-
out there. They didn't. I done seen them call for UTI. I done seen them call for sore throat. And because
Sore throat.
and because of Mtella, we can't turn. You can't refuse to take them.
Right.
You can't refuse them.
But you can
But
sit
they
them there.
need. But you know what they need to do is some states that they're fining people for that for abusing the EMS system. They need to start doing something like that because that is the worst. I just be ready to lose it. I be like, are you
I know.
freaking
I
kidding
can
me?
tell.
Well,
Yeah, she about to lose it right now.
I have a cousin
like
who's
you're
she's EMS along with some other certifications for DeKalb County in Georgia, and during the midst of pandemic, she has been in a vehicle that's been shot at. She's had a coworker attacked. She has gone to save other coworkers in another EMT vehicle because 3 of them got shot. They ended up riding up on a scene, and the people just started shooting at them.
And they're not allowed to
No
get out
provocation.
until that scene is controlled with like the
They
police.
were trying to get away because they realized what they had drove up on.
Right, and they can't do
There was
that.
nothing they
There
could
was
do.
nothing
Hold
they
on.
could do.
They were T-boned. This happened all last year. She has been T-boned, and then she was driving this last episode back in October, I think, and someone ran the light in front of her, and she ended up hurting her back. So people don't realize
That's the
that
emergency driver?
that's the EMS. She's an EMS driver. She rides and drives, and she's been doing this for years.
Because everybody can get it.
There was a fire truck out there. They had to save firefighters one day because they were being shot at.
What is
They had to use their
purpose of
vehicle
that?
to protect the firefighters from getting killed. There's no way to know what's on someone's mind.
That's just a question I'm throwing in. Like, that's the dumbest thing
but
I've ever heard.
The thing is that they put their life on the
Right.
line.
Yeah, they're friends.
Even being an RN and working in emergency, and someone comes in there crazy with a gun. They don't see if you have any weapons on you when you walk in the ER. Their lives are on the line, and people take things way too lightly into it's their own.
True.
They just don't realize that on top of everything else, you got this pandemic to deal with. You're not getting any rest. you know, your life might be shambles at home because you can't be there to even monitor what's going on at home. Some people can't go home because they actively have the pandemic and they can't be around their children, their spouses. They have to live separate, and they still go to work with this pandemic, still having to service. I mean, you know, like you said, the healthcare system is crumbling.
It is. It is, and I wouldn't want anybody that I care about right now to have to be a patient, because to be honest, the care that you're going to get is, I hate to say it, it was a doctor that just did an interview on KMOV. He said basically we're at a point where we're going to have to decide who lives and who dies. He was like, some people going to die. Some people going to die in that waiting room, or they're going to die and we get them to the back. Like, I've been in so many codes lately that I'm just like, it was different during the first wave because a lot of them we knew once we got into a certain point, you basically just was like watching them die. It wasn't that emergent, oh, let me try to save them. Now we're doing like so much CPR, you know, bagging people too. I'm just like, it's insane. And the majority of them aren't making it. You know, they're not. And it's really, really sad. And then I always have to sit and think to myself, man, did this happen because we didn't have enough staff? Like, I'm always, at each death, I'm in the back of my head, like, did we unintentionally do this? Because, you know, you have no intention on killing anyone, but it's like, could it have been different, you know? And all these people aren't old. I mean, I'm seeing people from their mid-30s on up that are just passing away, and it's insane. It is insane right now.
Now, and in terms of the pandemic, with the different vaccinations and boosters and whatnot, is there of course, there was always that rumor that a lot of things were being blamed on the pandemic when it really was actually cancer or whatever, because they might have had the pandemic in their system. It was labeled pandemic death and not what it really was, based on certain situations. Can you speak on that, or if not, we can move on?
I will. I have to speak on that, because during that first wave, there was a lot of government money, and 2 hospitals. I saw an article in USA Today. 2 hospitals were mentioned in that article from St. Louis that got millions and millions of dollars. But in order to get all that money, those deaths had to be labeled as COVID to get that money.
As pandemic. Right. Yeah, it's all good.
So I was like looking at some of these cases, and I'm like, how do you know that's what killed them? You know what I mean?
Right.
I'm just saying, like, how do you know that was specifically what did it? You don't really know. You really don't. You don't really know. And, you know, the whole big thing was, oh, well, they got these comorbidities. That's with anything. That's no different than the flu. The flu done killed, I don't know, flu done killed so many people.
Right.
We've been seeing that for years. We've been seeing that for years now.
I was like, where did the flu go?
I've seen it didn't go nowhere. They weren't testing for it. They weren't testing for it. And that's what that's what was killing me, because I'm like, all of a sudden, I said, so all of a sudden, ain't nobody talking about the flu no more. Usually every year it's flu. And no one was talking about it, but we were doing all of these panels, and on those little respiratory panels, you can test for it. It's like 7 different viruses on that panel. Why are we not testing for the flu? Because everybody wanted to focus on pandemic. Nobody wanted to talk about that. So now, this go round, oh, now we got flu-rona. So now you get, you know what I mean? Now you saying people getting the flu
and some Rona.
So now you can get the flu and the corona.
I knew nurses I worked with that had both. So I was like, why are we acting like this new? I saw this on the news station. They were like, the first patient to get it. I was like, that's a lie. My friend had both. She was sick as a dog. About sick as I was when I had it.
Right.
You know? But I'm like, that's craziness. So they don't know 100% for sure. Now, I have seen people come in there with no comorbidities. I mean, one fella he was chiseled, completely healthy. He ate healthy, worked out, everything. Guy was 35. Looked at that image of his lungs, they were gone.
Whoa.
It was just like nothing there. he was on the machine, kept having a conversation with his family, like, we need to pull him off. It's at this point, there's nothing we could do. Long story short, he ended up passing like 3 days afterwards. But I was like, that was the one thing that I kept, because I didn't get it for the longest. And I mean, I was like right there in the heart of it. And I kept telling him, I was like, I'm immune. I can't get it.
Asymptomatic, girl.
Asymptomatic.
Asymptomatic.
I'm type 1 and I got cardiac history. So it was people like me that I was seeing dying all the time. And at first I was scared and I wasn't sure if I wanted to work in it. And then I finally was like, you know what? I was like, nah. I was like, I got a lot of knowledge. I probably should be there so I can help out. And then after I was around it all that time, and then I rode in the car with my brother, and he was positive, and neither one of us had on masks, and I done went to breakfast with him and everything. Didn't know he was positive at the time, and I never ended up getting it. I was like, I can't get this. I was like, shoot, I'm gonna be at work every day. I was like, I'm Gucci. Look, so
Nikki, I am legend. The cure is in my blood.
I was all like, I'm work, boy. When I got back from Florida and I ended up getting that stuff, I thought I was about to die. Okay?
Boom.
I was like, I said, this about to take me out because I seen it take out too many people like me. And I was like, okay, all these vitamins and working out and eating healthy, maybe it ain't going to save me.
But do you feel like it did help?
It may have helped. The one thing I will say is probably only because my diabetes is well controlled. If it weren't for that, and even a lot of the doctors I work with, because I ended up with the pneumonia, my lungs, it was like diffuse. It was all over when they did the CT scan on me. And I did personally, even though I'm in the medical field, I'm kind of anti-medication. I didn't let them give me the steroids. I didn't let them give me antibiotics. I said, I'm going to let my body do what it's going to do.
Naturally,
And I let my body just heal itself. And I literally use the incentive spirometer every 3 hours. And I just, my little joke.
I hate the thing.
On these players.
I was like, lungs going to be awesome.
Like, little Bobby,
going to be tight.
But you know what? That's probably the thing that saved your life.
Girl, it does wonders.
Yes,
I had my brother worked as an ICU nurse. We worked at the same place. I said, drop me off in center spirometer on this port. I was like, I was looking on that thing like crazy.
Push-ups. All I rather do push-ups.
It did wonders.
See, I'm a zinc, elderberry, black seed oil, B, C, and D. I take them every day.
You like that D, don't you?
Hey,
I was like, you setting them up.
Right now.
but
That's
I'm
the only
like, but
D
don't
I'm
knock
getting.
that D is like,
It's the only D I'm getting.
I'm a transplant patient. I take it every day.
yeah, so see, you know,
But
yes.
the setback is that I also take autoimmune medication. So, oh yes, ma'am.
So now I have a question for you. So have you gotten COVID?
No, by the grace of God. And it's only by
Thank
the grace of God. I'm not going to say I was safe. I'm not going to say,
Thank
because
goodness.
what happens is that if I get COVID, they have to take me off of my.
You know, I know. That's
So
why I asked.
once they take me off of that, either I'm gonna be cured from COVID, or I'm gonna lose this. I'm gonna lose this kidney. So I might go back on dialysis, or I might die.
Yeah.
So those are my options. I've had other infections where they had to pull me off the medication, not completely, but mostly, in order to let my body and my immune system work so well that they took a huge risk. And they were like, come in and do blood work every 3 days. Come in and do blood work. Come in and do blood work, because they had to see where I was at. So yeah, it's really serious. Really serious.
Absolutely.
So you didn't answer my question. Do you think that it works?
Oh, yes.
Zinc,
Yeah, that's what I was going to say. I do think taking all of that stuff and boosting up your immune system, I take a lot of that same stuff that you mentioned. I was like taking that on a daily. So
Yeah, I take it every day.
yeah.
Every day.
And that black seed oil, but it's good stuff.
Yeah.
And
that sea moss.
Yeah. Yep.
That
I
sea
do.
moss is.
Yeah, I take one that's like a supercell food. It has like bladder rag, sea moss. Yeah, I take that every day also.
Where you get that from?
Amazon.
Okay. I'm gonna get the name of it.
Yeah.
Because I'm so big on that. Because I know I had it when it first came out. Very first. Before they even knew what the name of it was.
Oh
I
yeah,
remember I
because you
was
know
saying-
it was out here before
Yeah.
they.
And
who
I'm
knows
thinking
how long
flu,
it
though.
had kind of been around.
Only
yeah.
thing that stopped me from thinking it was the flu, I was in Texas. I just flew to Texas. I was in Houston. I drove down. When I got to Houston, I was cool. Then all of a sudden, I drove down San Antonio. I started feeling kind of feeling bad or whatever. Only reason why I know that it probably wasn't the flu is because I lost my taste. I lost my smell. But I'm from the South. I did all the old school stuff. I did the Vicks under the feet with the onions. I did the potatoes. I did,
Oh,
put
yeah.
that Vicks
That
up under there.
Girl,
that
you
onion.
made soup. You don't hear that.
No,
made
but I
feet
did. I
soup.
made soup. I made a hot
Thing
Thai soup.
is big. Pull them toxins.
Yeah, pull the
pulls
toxins and
toxins out.
potatoes.
Yeah.
If you just want to pull toxins out of your body
The
just
starch
because,
pulls it out.
put it at the
Yeah.
base of your foot right here. Cut it. Put it at the base of your foot. Put your sock on. Go to sleep. And when you take it out, it's gonna be black. You'll see all the toxins coming up out of there.
Yep.
But I did that with but like I said, just fighting the whole thing. I made me a hot toddy with some Mucinex. And I kept drinking ginger ale to keep my stomach from feeling so sick all the time. So then after like 2 or 3 days of that, every morning I woke up, I was cool. It was just only at night I started feeling like achy.
Oh yeah, that's in the body. It goes in
And
the overdrive.
Then I started taking I got back to Houston. I started taking ginger shots. Started taking my elderberry. I'm talking about within not even a day or so. I was back to good. I didn't get my smell and stuff back. My taste came back first. But then the smell kind of took a minute for it to come back. And I'm like, I'm a woman. You can't be without smell.
No, you're right. Same for me. I'm taking showers and I can't smell the soap, and it was driving me crazy. I
Up
was
a
like,
wall. I don't know if I'm offensive. I mean, I know for the most part, but you know, man, as a woman, you like,
it's weird.
I got
You
to
gotta be
smell
able
something.
to smell.
I need to know what's cracking down around here.
Did I just poop?
Yeah.
And I can't smell it.
Right.
I'm trying to set it off everywhere I go.
Like
Just
the
see
taste
the way. But I was like, it finally
grocery
came
store.
back. But I remember the day, I did, and oh my God,
Like, wait a minute,
I can smell. I
know.
started smelling everything. I was like, yeah. So I knew I had
I
it.
know Max would appreciate that.
You don't
My,
appreciate it till it's gone.
Yeah, that's
my
for damn
my
sure.
grandmother, when she was 85 last year, got COVID from an aunt.
And she pooted.
I'm sure she did. But
Go across the table. Just go ahead. I'm gonna turn my head.
she started feeling down, but other family members noticed that she wasn't herself. And my other aunt took her to the ER. They gave her fluids because they said she was dehydrated. She lost her sense of taste and smell. The next day, they sent her home that night. She drank water, soup, whatever they could get down her. By day, that was day 1, day 2, day 3, it was like nothing had ever happened. She takes vitamins. She always has. She takes natural herbs, and she eats a piece of aloe vera plant every freaking day. Most of her
Aloe vera's
life.
good.
Aloe
My
vera
granny
plant.
was like that.
A piece of the plants. She's always grown aloe vera plants every day.
My granny like that too.
With them being with the different makers of vaccinations and vaccines and whatnot, and the booster, with seeing what you see in emergency rooms, is it really that much of a big difference to have that booster in your system to fight it in comparison to not being vaxxed at all or having 1 or 2 shots?
You know what? To be honest, the majority of the people I've seen, they're not getting the booster. The majority of the ones I've seen. Now, I'm going to say this, because, they keep saying, oh, the majority of the patients that are in the hospital, they're not vaccinated. That's not true.
That's a lie.
It's a whole lie, okay? Because I can see their freaking vaccine record, in the chart, or I'm asking them, if it's not one where it's linked up with us, I'm asking, did you get, both of your vaccines? Because I like to keep a little
Mental
tally
track.
in my head, And they're like, yeah, I'm vaccinated. Still in the damn hospital.
Yep.
But are they boosted?
No, most of the time they have those too, but then it depends. I don't have a booster yet, but it ain't even time for me to get the booster. According
They
to
approved it. You don't have to wait 6 months anymore. You can get it at 5.
I saw they said that,
Yeah.
and I'm just about, because I literally just got mine because I was one of those nurses.
Waited.
Yeah, There, I was all like,
I was scared too.
Right.
I said,
yeah.
think we gonna be the damn zombies on the Walking Dead.
That's
like,
what
I just wouldn't trust being someone.
I thought I was gonna have an
said,
ass over here when
still-
they got finished,
being
baby. I
some-
didn't know.
being
I was
someone
scared.
that has done a lot of medical studies and knowing how long that takes, I said, you can't tell me you tested this enough to say, okay, yeah, it's safe. Let's
That's
get
the
it.
part that
And
scared
you
me.
can't cure the common cold.
Yes.
But you,
Yeah,
you
right.
found this
And
in a
it's a
matter
virus.
of,
Virus,
and it's a
virus.
virus.
Virus,
We got
virus.
Yes.
leukemia, cancer, all these things out here that y'all been for years.
So, you know.
That y'all still haven't found a cure.
Well,
Well, we
money
don't
is in
know
the
that. We
treatment,
just
not
know
the
what the
cure.
pharmaceutical
I
companies
was
put
just
out
The
there.
money is in the
They,
treatment.
the
not the
money
cure.
got to be made, baby.
Because
Money
it's
got to be
people
made.
Yeah,
that-
well,
people
my
that
point.
have found cures to things, but like you said, all of a sudden they
Exactly.
magically come
Because
up
Dr. CB
dead.
ain't
Disappeared
there,
or
and then the
dead.
person that was following Dr. CB is gone, and some people
Yes.
just
Several other
disappeared,
people,
and
Yes.
yeah,
I
so
mean, you know, certain people, just like me being diabetic, I'm a cash cow. I'm completely insulin dependent. I cannot come off of this. They know this.
and that's why
I
they
would
keep
be
that
dead.
price up there.
Yeah, their insulin is ridiculous.
Well, especially the type that you get too, because they want to put most people they throw on that mess that they give them,
Yeah.
and they have all them side effects, and they really ain't being helped. You know what I'm saying? So yeah.
It is. So I personally, I don't know what I think about all of this. Okay, we gonna. So I was like, okay, so we just gonna keep getting shots every 4 to 5
That's
months.
what I was just gonna say.
Who's gonna do that? Because a lot of people, they get these, even people that I know now that've gotten a booster, they're like, man, I was sick for 3 days. Who wanna feel
After the
like they
booster.
got it? Who,
Yeah.
You know what I'm saying? Who wants to keep getting shots and then every time you get it, you down?
You down, but then you end up getting it. Like, it's not doing.
So they're like, okay,
When you
is
talk
it
about
really
They're not
worth it?
promising that you're not
me.
gonna get it. They
Yeah.
just say that it's supposed
easier
to
to
lessen
survive.
And that's the
lessen the effects.
And it's a survival.
But-
It's a survival race boost.
Basically,
Right.
yeah, they're saying you're not supposed to. You're not supposed to die from it. But what I will say is,
Okay,
we
I'll
aren't
try not
seeing
to.
as many. I will say we aren't seeing as many deaths, but we're definitely seeing people coming in still extremely ill from it. That, like, to the point that I wouldn't expect to see and you're vaccinated.
Right.
Because if you're telling me, I'm looking at this like other vaccines. Think about the chickenpox vaccine, and like any of us that got kids, and your kids got that chickenpox vaccine, compared to when I got chickenpox, and when one of my kids never got it with the vaccine. One of them did get it, but he got it, and after about a day and a half, the stuff was
That's true.
gone.
Yeah.
yeah.
You know what I mean? So it's like, why the virus ain't like that? I mean, or the vaccine isn't like that to where, okay, I'm going to get it. Okay, I might have no symptoms and I'm good. But then I know people that got the vaccine and they got it around the same time I did. They were fine. They was like, oh, I just lost my sense of taste and I'm good. And I'm up here feeling like I'm about to die. I'm like, oh my God. Fevers
what
for
is
3.5
it? Yeah.
weeks
Oh,
straight.
my God,
So
no.
part of it, they don't really know. Part of it, I wonder if it's a genetic component to it.
That
To
could be
where,
it.
because they're saying they do think there's a genetic component to where some people, I've known whole families that no one really got sick.
Yeah.
You know what I mean?
But-
No, they share the same genetic material.
Right.
But isn't it mutating kind of now? It's like the Crohn, the Marion, and then
You had,
the.
hold on.
Girl, I'm like,
I got a
wow,
list
this
right
stuff
here.
don't go on
You
somewhere.
had. Now, this
That's
is,
what I'm saying,
These
but
are
that
different
they-
variants. You have the alpha, beta, gamma, epsilon, eta, iota, kappa, mu, zeta, and then recently delta and omicron. So
Wait, those are real for real?
Yeah, those are real.
This sounds like somebody.
those are different.
too.
different
That sounds like
variants.
some pledges.
My question
Greek
is,
It was Greek though, yeah.
but
Like you just
because
pledged.
in my way of thinking, the first one, who's to say that ever went away? Now they're saying everyone that's in the hospitals or sick is the Omicron. But how do you know that? Unless you do deep testing, there's no way to know
And
that.
that's the
Unless you
thing.
put it out
Just
there.
like when the Delta came out,
Yeah.
I don't know if that was the one that
Right,
I had,
exactly.
because you just getting a basic panel.
Mm-hmm.
There's a
Workup.
particular, there's extra testing they have
Yes.
to do to tell, because they
Which
looking
one
for
is which?
certain spike proteins
Mm-hmm.
to see if you got it. They're not doing that on everybody. Ain't nobody got time to be doing
The
all
only
that.
time that they're
So
doing
they're
that is when
making
you're admitted
assumptions.
and you're actually going through all the blood work.
I know somebody specifically that's asymptomatic. They've had it twice. And they keep going back to the get tested. Yeah, I got it, but I don't feel none of the symptoms.
Look at this.
Who me?
No, them.
Yeah, after the second time. Yeah, after the
But we're
second time.
Yeah, my brother was
And he-
asymptomatic with the first one, and he wasn't vaccinated.
Right. That was before the vaccine came out.
This
Had
is-
it before the vaccine, then got it after the fact.
for those who aren't,
showed up for me
for
2 months
those
ago.
who have been around for a while and know what's going on currently with the pandemic, I would like to read to y'all, just a little thing for those who aren't in the know about the different, so that way you'll know exactly what it is when it comes to the virus and the exposure. The Pandemic-19 affects different people in different ways. Infected people have a wide variety and range of symptoms, from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have the pandemic. It includes, these are some of the symptoms: fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, loss of taste and or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. But also, look for these emergency warning signs for the pandemic in your system. If someone is showing any of these signs, seek emergency medical attention immediately. And that is trouble breathing, persistent pain and chest pressure in the chest, inability to wake or stay awake, pale gray, blue-colored skin, lips, or nail beds, depending on skin tone. But most of all, call your medical provider for any of these symptoms to see if it's severe enough to go to the emergency room. Now, based on what I read, is that pretty hit spot on or not?
Yep,
Okay.
I agree. Now,
Nail beds are blue.
especially like with the chest pressure, I know for me, I ended up going to the ER twice, and I might want to go to the ER. I had to feel like I'm dying. But I've had a heart attack in the past too. Wow. So when I was like I was like, oh my gosh, it was like crushing. It felt like when I had my heart attack, and I was like, am I having another heart attack? And then of course I got all this stuff at home to do my blood pressure and check my oxygen levels and whatnot.
Right.
And I would get up and walk from like here to like that chair, and my oxygen's dropping down to like 85%. And I was like, oh my God. I was like, I think I might have pneumonia. And this was the other scary part, and I've heard other people say this. It messes with your mentals too. It had me ready to commit suicide. I was this close to taking my own life. I was just going to overdose myself on my insulin pump. It was like messing with me on a mental level like none other. And I didn't even call D, because I was like, I didn't want him to like talk me out of anything. Damn. But I had written out stuff of what I wanted my kids to have. Like, I was really ready to go there, because I thought it was just going to kill me, and it was like messing with me. So I was like, well, I'm going to control. I'm not going to sit here and suffer. Right. I was like, I'm just going to take myself out. It had been going on 4 weeks, and I was still, I've never had fevers that long in my life. I'm talking about 102, 103 degree fevers that I was running week after week after week, not keeping nothing down, which is dangerous for me being diabetic, barf bags all around my bed. And then I'm living out in an area where I ain't got no family. I was out there by myself. But I'm going to tell you what, them white folks took care of me.
They do. I was just going to say that.
Baby, soon as one of them
those neighbors, you got the neighbors?
Yes.
Yeah.
Soon as one of them found out that I had it,
soup.
I opened up, there was phone numbers plastered to my door. There was bags of water, soup, sugar-free Gatorade, because they knew I was diabetic. The fact that they even remember that was like insane to me. They were checking on me. They was like pulling my trash can out to the curb, putting it back.
When I say they're the best neighbors,
they great.
I live in O'Fallon.
See,
so
I'm out there too.
Yeah.
Girl. When I tell you that it's like completely.
I come outside and they didn't shovel my snow. They didn't.
And then most of them retired, so they ain't got nothing.
They done do it.
They ain't got
They can't wait to find something to do.
Right.
They got a project.
Yeah.
I walked out and I was like, they didn't clean my car off. And I was like, I love y'all.
Yes.
Thank you.
Beautiful.
That's what's
Yeah,
up.
it is. It's beautiful.
That's what's up.
Because us, we ain't doing
Absolutely not.
I'm sorry.
They be like, oh, I wonder she died.
You right. She looked right.
She ain't left all day. Look, ain't no tracks on the driveway.
Hey, you don't need that lawnmower, do you?
Yeah. No, they not gonna ask. They just come over there and take it.
No.
She ain't been
No, the
outside
police
all
was
day.
over there the
Because
other
they
day.
did. They
No,
were like,
I'll give you a wellness
they're
check.
like, we were so worried about you in there. We didn't know, like, if especially with your diabetes. And I was like, I'm fine. Because one of them, I was gonna have them. I ran out of test strips. My sensor wouldn't work. And I don't know what it does to the cells or whatever, but I wasn't able to wear my sensor to test my blood sugar. None of them would work. So I had to manually check my sugars, which I don't do anymore. I didn't have any more strips. And I mean, I was trying to prevent him from having to come out there, you know, day after day. And I was like, dang, I already text one of these neighbors and tell them to go to Walmart and give me some strips.
They done ran. They been like,
All you gotta do is call them up and didn't mention it in the conversation.
yeah, they done ran over there. They done be like, you need some strips? They can't wait to help you.
Because I would have got on Amazon.
Let me look in the basement. I'll make you some.
Right.
Be right back.
Right. They can't wait to help. I love it though.
You gotta keep you one or two in your pocket.
You gotta have one too.
Beside glass, I ain't gonna lie. He had all the bodies in the basement.
Yeah.
That's what's up. That's what's up.
I'm just biased.
So, any questions, comments, or concerns for Nikki before we end this piece?
Is it time to go already?
Got about 5 more minutes.
I think
But
the
that's good
information was really
I'm
great.
glad you're good too.
Absolutely. We just hearing it from a way better standpoint. It makes a total difference.
Yeah, it does. It clears up a lot.
But it also gives you a lot more empathy because,
taking it.
you know, you sit for anyone who sit up and says, well, you know, I don't want to take the vaccine. Whether or not you take it is your business, but at least be informed and don't say it out of ignorance because
That's
you
it.
don't realize that the more that you run to the hospital, the more you put the
People
staff
in
in danger, and they have kids and families to worry about.
down.
You know, and you're not worrying about, you know, you come in, you don't know if they've had a meal that day, you don't know if they've even sat down that day, you don't know what health issues they deal with. The nurses that I know personally, they all got into nursing because their own illness. So that's what motivated them.
That's usually how
And
it goes.
so, you know, you're not thinking about that other person. You're being selfish, and that makes you the ultimate asshole.
Yeah, if it's all just about you.
Right. So before we part ways, I would like, once again, Nikki, please express right now, full transparency with cussing and everything. Tell these motherfuckers exactly what not to come to the ER with. Y'all ready? Hold on, here we go. Hold on, here we go.
Wait till the last 5 minutes.
Hold on, here we go. And now, Audio Audacity exclusive. On to you, Nikki.
Please do not run into the ER because you got back pain, UTI symptoms, sore throat, anything that's not going to kill you. You should not be in the emergency room. Right. You need to be at somebody's urgent care, or you need to be calling your doctor. If you don't have a doctor, urgent care will probably be your best bet. That's why they came up with urgent cares, to give emergency rooms a break so that we can handle what? Emergencies. Like, we don't have time to deal with this foolishness.
Right.
We really don't. And if you are going to come, at least be nice. At least be patient. You know what I mean? Everybody's struggling right now, not just the hospitals. If you look around, everybody's short. Right. There's nobody working. Nobody wants to work. You know, I mean, you gotta, if nothing else, this should be teaching us some level of patience, because that's just how it is right now. It's bad. But yeah, please don't run into the emergency room for things that are not emergency. It might be an emergency to you, but if you're not about to die, don't come in there. You need to not be there, please. It's like, go to an urgent care, because we are busting at the seams right now. We cannot handle it.
Right.
And it's gonna cause some unfortunate deaths of some other people, because we got to take time and do stuff on you when we could have been actually literally saving someone's life.
Okay. All right, you heard it here first, y'all. Keep that
Oh,
audacity of the bullshit you own
Go
to
on
yourself.
YouTube and see if you can find your diagnosis.
Right, what she just said. So in the meanwhile, in between time, allow me to, we're going to wrap this thing up right here, and we're going to break it on down right here now. To check us out, you can check us out on Facebook on Audio Audacity Podcast, Instagram, Audio_Audacity_podcast, YouTube, Audio Audacity Podcast. We're also posting these same videos on YouTube on our old Freaks of Industry podcast. So if you're already a fan, just watch us there as well. You can check us out. You can listen to us on Google, Apple, Anchor, Spotify, Spreaker, and anywhere podcasts can be heard. And in parting, if you have the gall to do it, we have the audacity to talk about it. And that's our show, y'all. Catch y'all next week.
Booyah.
That's so cute. I like that little laugh.